Hello, my name is Lester Martin. I have prepared a number of things in what I call my retirement deck related to health insurance, Medicare, Social Security, and other things that are helpful for predominantly AT&T employees, but perhaps others. This particular short segment is very specific to AT&T employees and retirees and would not generally apply for other people. So you might choose not to attend this. What you're looking at are slides that are from the deck. And I'm going to go through this, and if you have questions, you're going to need to either reach out to me at lesterrmartin@gmail.com or at lestermartin at 732-533-9290. So these are AT&T health insurance options for employees and retirees and dependents of the retirees. And this is designed to deal with the fact that these three categories of people and other categories do not have all the same characteristics and therefore may have very different insurance. The columns are characteristics like, does the employee qualify? So this applies specifically to the related employee. And then the second and generally the other columns relate to the insuree associated with that employee. So it's the insuree's age, whether it's the employee, a retiree, or dependent. And if it's an active employee, then the information below talks about what the health insurance options would be for that employee. And the second column would be if the employee has retired from AT&T, and the third, that is, they have left AT&T. And the third column, or last column, is the information for a dependent of the employee, whether it be a spouse or a child that may still be under 26 and therefore might apply. All of the first two things are related to the employee and whether they're qualified. That's the term. It says, are they qualified for retiree insurance from AT&T? Some people after a particular date were not. Some people prior to that date were qualified, but be fully qualified, they have to, in most cases, meet the rule of 75. And the rule of 75 says that the employee meets the combination of years of age and years of experience at AT&T, such as 50 years plus 25 years experience, or 55 plus 20, or 65 plus 10, 60 plus 15, explicitly not included in the rule of 75 for some strange reason. And notice that it is explicitly those numbers or more. So 52 plus with 23 years of experience do not qualify, whereas 52 years of age and 25 or more would. So you have to reach the plateau, and then you have to reach the plateau on the second element. If the employee is qualified and the insuree associated with that employee is below 65, then and we're talking about an active employee in this particular case. So they're qualified, but that's not terribly relevant because if it's an active employee, they're going to get active health insurance from AT&T, perhaps United Healthcare. And for the employee, it might be $23 a month for an employee and a spouse, $77 a month, and an employee plus a family, $158. Now, these are numbers from 2015, and the numbers will have gone up, and also there are options available, I believe, such as gold or bronze, that are not represented here. moving on, if this qualified employee does retire from AT&T, but they're under 65, then they're going to continue to get, if they sign up for it, the active health insurance from AT&T, such as United Healthcare, but a different cost. But in this particular case, for the employee, for me, it was $23 after I retired, just as it had been $23, I believe, prior to that. But the difference is that in my case, I was paying $23 because my spouse was not below 65. So this brings up an important point. You may very well have the employee be under 65 for a few years and then go over 65. You may have the spouse be over 65 from the beginning or may go under. And once one of the two or either or both of them reach 65, as far as retirement is concerned, they will go on separate plans. As active employee, they're more or less tied together, but as far as retiree or the dependent of a retiree, then if they're over 60, if either one's over 65, then they have to get their own insurance as described here. So going back up here to the retiree, I was paying $23 a month for the regular health insurance plus the copay and the deductible. And this was high deductible. If in fact it's only one person, the employee, then they would be on something like a $1,500 annual deductible. Whereas if it's a family, it would be on $3,000 deductible. So that's still one plan, as long as they're active employees, or if the employee is retired and both the employee and the dependent are under 65, then it would be a single deductible of, I think, $3,000, or it may depend on which plan you get. Moving over to the dependent. So this is a dependent of a qualified employee but the dependent in this case is below 65, and so they continue to get the active health insurance from AT&T, perhaps through United Healthcare, but the cost does go up whenever the employee retires. So whereas for me, the retiree cost insurance did not go up much or not at all for that last year. For the dependent, so mine went from 23 to 23, but for the dependent, it went from a combination of 66 up to 258. So the dependent would perhaps have to pay as much as more than $100 to $200 a month, and a family would have to pay perhaps as much as $500 a month. So the dependents on the dependent health care for below 65, in fact, goes up significantly. Now, if the employee is qualified, but one or the other of the insurees is over 65, then everything splits up. Of course, here we're talking about if they're qualified, the active employee would still be on United Healthcare and would have whatever plan they choose. If they're retired from AT&T and they're over 65, then AT&T, as of the 1st of 2015, stopped providing any kind of a health insurance directly, and the AT&T retiree has to sign up for Medicare Part A and B and D, and either gets a supplement or an Advantage plan. But AT&T does provide approximately $2,700 per year, prorated if it's less than a year, for the employee, and so they can use they then use Aon, and they get this the D and the supplement or the Advantage. They get A and B through the government through Medicare, but they need to get especially the retiree has to get something out of Aon for the insurance and to get the HRA of $2,700 per year. If something is bought through Aon or through the benefits insurance, depending on the age, if something is bought through Aon, that is either the Part D or the Medigap or the Advantage, then the HRA of $2,700 for the retiree should be forthcoming each year. For a dependent that is over 65, they have to get their own plan, and they get A and B and D and a supplement or an advantage. And what happens is that AT&T provides $1,500 a year for that spouse. One assumes that probably the other dependent is not over 65, or if they're not over 60, if they're over 65, they're not qualified. They're not covered under this insurance. AT&T pays $1,500, so it's a total. If both of them happen to be over 65, the retiree and the dependent, they get 27 plus 15, for a total of $4,200 per year. Now, this is not a bad spot to stress that if in fact the employee dies, then the dependent insurance goes away completely, regardless of the age of either the employee or the dependent. If the employee that is therefore qualified for the insurance goes away, whether they're active or retiree, the dependent's insurance goes away, and AT&T makes no contribution. Now, that's partly covered down here. If you have an employee who is not qualified, that is, they don't meet the rule of 75, or if the employee dies, and the insuree, let's say, for instance, the employee is below 65, then because this is qualified, the active insurance, this really doesn't apply because in this particular case, they are qualified enough so that they do get active employee insurance. So instead of being not available, it goes up here. If it's below 65, then if the insuree is below 65 but the employee is not qualified, then the choices that I'm aware of are COBRA or Obamacare. And here are some examples of what I think COBRA might cost, as much as $17,000 a year. And this is short term. I don't know whether it's 6 months or a year or more, but those are the choices. One should be able to go directly into COBRA or into Obamacare and remain health qualified, so they shouldn't have to meet health underwriting. If the dependent, if it is a dependent of a employee who is not qualified, and the dependent is, of course, below 65, then their choices are the same. That is, they get COBRA or Obamacare, and as long as they're below 65 and they're no more than 26 years old, then this qualifies, and these others. Employees that are not qualified, but that the insuree is over 65, this once again doesn't apply up here because you go up here and the active employee information up here covers whether they're below or above 65, but the retiree has a different situation. So the employee is not qualified, and therefore they have to get, when they're retired, they have to either stay on COBRA for a while or go to Obamacare, or hopefully this could be an interim solution until they then turn over 65. If they're retired from AT&T, the COBRA and the Obamacare apply, and if they are a dependent, then the COBRA or Obamacare apply. If the employee is not qualified or the employee dies, then, well, of course, that's not applicable of active employee because it's kind of hard to be active and also dead. But if they're over 65, the insuree needs, if the retiree himself or herself needs to get Part A and B from Medicare and Part D from insurance from the same carriers, not necessarily Aon. I guess Aon might do it, but some other vendor might provide that insurance, and there's no reimbursement. So honestly, the insurance here and the insurance up here for over 65 is really identical. The options you have are identical. The difference is that if the employee is not qualified, then they do not get the HRA of $2,700 to help pay for that. So yes, that means that an employee that doesn't get is qualified gets decent insurance as a retiree and on Medicare, but they're having to pay $2,700 a year out of pocket. Not a bad deal. Moving over here to the dependent of over 65. Well, the dependent, if the dependent were over 65, this in some sense doesn't really apply because it would not be a dependent and also be 65. So I'm sorry, it could be a dependent a spouse, in which case they have to buy their own Medicare Part B, D, and Medigap or supplement or Advantage, and there is no reimbursement from AT&T. Now keep in mind that if the retiree is below 65, and then you might have this, and if their dependent is over 65, so you can easily have a case where the retiree is under 65 and the dependent is over 65, or the other way around, or they could both be under 65 and they would, or they could both be over 65. And these rules, all of these rules apply individually for the insuree, with the exception of the first column talks about whether the employee, not the insuree, but whether the employee is qualified. This largely applies if both the employee and the dependent work for AT&T and are qualified, but you would simply follow this rule for the employee that's AT&T, and then follow it again for the dependent who is also an AT&T employee or retiree. And so the main difference would be, I believe, that if they both were, then by the time they retire and they're over 65, each would get their own $2,700. And so instead of a total of $4,200, you would have a total of $5,400 of HRA to pay for the individual insurance through Medicare. Going down to Care Plus, this is something that we get that we have to pay $2 a person per month. Generally I'd ignored it because it indicated that it was helpful for some experimental treatments. That didn't sound very useful, but then I found out that there's a rumor that it paid somebody for a 3D mammogram, which more and more doctors are suggesting instead of the normal 2D. Medicare and maybe the insurance, the normal insurance doesn't pay for the 3D, but I've been told that the Care Plus does. And there is also a rumor that Care Plus can help pay up to $1,000 for a hearing aid or per hearing aid. So we'll need to get facts on that. So this is the information about the options for health insurance for an AT&T retiree, active employee, or for dependents. There will be another section if you're interested in the information on the Medicare. There are other slides that I'll cover, and that will be in another recorded section. Thank you very much, and I will stop the talk at this point.